Welcome to Talk Law Radio with attorney Todd Marquardt of the Marquardt Law Firm at marquardtlawfirm.com.
Welcome back to Talk Law Radio. I'm Todd Marquardt here on 9:30 a.m. The Answer, also on podcasts and Facebook Live. Next, look for us on YouTube and subscribe to our channel so that you can watch short clips of the show whenever it's convenient for you. We've been talking about incapacity and guardianship here with Dr. Jason Schillerstrom and paralegal Sharyl Mays. Dr. Schillerstrom, tell us from a physician's point of view, is there any difference between the word incapacity and the word incompetent?
Yes. So physicians are taught that competency is determined by a judge. It's up to a judge, and only a judge can render a person incompetent. Capacity refers more to the biological processes that mediate, decision-making ability. So capacity is, all of the medical processes going on and the way you think that inform your decision-making. So a person can be incapacitated but still found competent, for example.
Okay. And so when would a specialist be needed? Is this something that general practice MD can determine based on their education and training? Or is a specialist like a psychiatrist or neurologist needed for that?
Yeah, by Texas law, any physician can make an opinion about a person's capacity. Any physician. And so specialists are often called when, the primary care doctor might not be comfortable making that decision. They might feel like they don't have the right training. They might feel that their relationship with their patient makes it inappropriate perhaps for them to make a decision like that. And so then specialists are called, in a way as consultants to help settle the issue.
Okay. And so you're a psychiatrist. How does that specialty frame or provide a different lens for you as like opposed to a neurologist?
Yeah, good question. So psychiatrists are mental status exam experts. That's what we are, right? We're experts in the mental status exam. We're experts in mental illness like schizophrenia, bipolar, depression. In geriatric psychiatry, we're also experts in dementia and the mental status exam of a person with dementia. Neurologists also work with a lot of patients with dementia. At UT Health, our Biggs Institute is a dementia specialty clinic. That all being said, I can tell you in the hospital, whenever there's a capacity question, it's psychiatrists who are called upon.
Okay. And just being a geriatric psychiatrist means that that's the population you focus on.
Yeah, that's the population I focus on. Probably the average age of my patients is about 76, 77 years old. About 2/3 of them have depression, anxiety, something like that.
Mm-hmm.
Probably about 1/3 of them have some type of dementia.
I was reading somebody who wrote that an older person with dementia sort of exhibits some of the same behaviors as somebody who has been diagnosed with dementia.
As with what? As with
somebody with depression.
With depression?
Exhibits the same behaviors as somebody with dementia.
It can. There can be overlap. The biggest modifiable risk factor for dementia is depression. So if you want to prevent dementia, prevent depression.
Okay.
Mm-hmm.
Interesting.
Yeah.
And there's different kinds of dementias, though, too.
Yeah, that's right. So dementia, really all dementia means is that someone has cognitive decline. Their memory, their executive function, other cognitions are declining, are impaired. It means that they have functional impairment. They're not able to take care of themselves in the same way they used to. And the reason for the impaired self-care is because of the cognitive impairment. But there's a lot of ways to have dementia, right? So people can have Alzheimer's dementia, vascular dementia, Lewy body dementia, Parkinson's, Huntington's. So dementia is the big diagnostic category, but there's 1,000 ways to be demented.
Okay. And from a layperson point of view, sometimes that's forgetfulness, or sometimes it's just the inability to make correct decisions.
Yeah, so decision making certainly enters into it. From a layperson's point of view, in cases of like Alzheimer's disease, memory is definitely the most apparent, right? Memory impairment's definitely the most apparent, the most notable. But there's other dementias too, and so really when people can no longer problem solve, right? When they can't figure things out, when they can't solve problems that are independent from their habits and their routines. They're trapped by their routines. That's when we become most concerned about dementia.
I think that sometimes family members are too close to see it. Mm-hmm. My mom's mom, later we found out that she had Alzheimer's. Mm-hmm. But, before she was diagnosed, we really didn't know what to call it. But one time, she was going to write a letter to my aunt. And I just happened to be there, and her and my mom were talking about her writing this letter. And she kept saying, well, what do you want me to write? Mm-hmm. And my mom would say, well, you're going to write her a letter telling her about what you want to have done, in your final days or whatever. And she kept saying, what do you want me to write?
Yeah.
So, she couldn't make that connection. And that's when I sort of realized that something was not right.
Yeah, subtle things. So Alzheimer's, it creeps up on people, right? Probably another similar example might be when families take their loved ones to a restaurant, right? It's a new restaurant, and the elders presented a menu, for example, and they just can't make it through the menu, and they essentially say, they tell the waiter or waitress, I'll have what my daughter's having, right? And so they're just not able to make they're just overwhelmed by new information.
Cheryl, can you think of an example of something that is observable by a layperson?
So I know for myself, whenever I go to the grocery store and I see an elderly person walking around kind of looking aimlessly or lost, I make it a point to go up to them and say, can I help you? Also being at the bank, we always looked for red flags of people being brought in under a bad influence to change their bank accounts. Mm-hmm. It's easy to exploit somebody that still has the whereabouts to know where they're going, but not the purpose of what they're there for.
Mm-hmm. So you're talking about some of your experience when you worked for a trust department at the bank.
Yes.
So you haven't always been in private practice. You worked for a bank trust department at one time. So you have that experience as well. Okay, good. Yeah, that helps answer some of those fine differences between the different dementias and the difference between memory loss and problem-solving skills. How about like organic causes? Is that where somebody's born with a developmental disability?
Yeah, so historically in medicine, brain disease, if you will, is distinguished, organic versus more functional. And so usually we think of organic causes maybe as being like a stroke, some sort of brain lesion, a tumor, something like that. But there's a lot of mental illness. There's a lot of dementia where, you can take an image of their brain, you can take an MRI of their brain, and their brain doesn't look any different from anybody else's. So that would be things like schizophrenia, intellectual disabilities, like you're describing, those sorts of illnesses.
And so specifically with somebody who has an intellectual disability, do they do the same testing to find out what their limitations are, or at least how to describe it?
Yeah, they commonly have, IQ testing. A lot of times that's done through the school system, that kind of thing. And so, so a group of, normally I do capacity assessments for elders. By and large, it's elders. But it's also very common. It's common for me to do capacity assessments for families who have a 17-year-old, 18-year-old who's about to be a legal adult. Their child has an intellectual disability or autism or something like that, and the family wants to be able to continue to care for their child and be responsible for them and make sure that they're safe. And so I'll do capacity assessments for those patients as well.
And you've probably run across a patient or two before that sort of had those two things combined, an intellectual disability and maybe some dementia or Alzheimer's, or is that a possibility?
Oh, sure, yeah. Probably where I might see that commonly might be with persons with autism, for example, where they will have lived with their parent for not just years, but decades, in fact. And they grow to be old, and then their parent dies, and then they're kind of left alone in the world to figure things out, and they just can't. And so yeah, we'll definitely see that as well.
And some of the symptoms that a person might exhibit with those types of disabilities, does it ever get better or worse with treatment?
So people can be incapacitated from things that are treatable, right? So you can be incapacitated from depression, and depression is treatable. You can be incapacitated from psychosis, and that is treatable. So the answer is yeah. A person can have a reversible incapacity.
Will you say more about psychosis? What is that?
Psychosis is, it's essentially it's hallucinations or delusions, right? So hallucinations might be hearing voices that aren't there, seeing things that aren't there. Delusions are having, fixed false beliefs, believing that, it can be paranoid beliefs, for example, thinking that people are in your attic trying to poison you, just, bizarre things like that.
Okay.
And so those symptoms are seen in patients with schizophrenia or bipolar or depression disorders, and they are treatable.
Okay.
Do you see dementia caused by like alcoholism or drug abuse?
Yes. Yes.
How does that work?
Yes, we do see it. We do see people who have just a lifetime history of heavy alcohol use where the neurons in their brain just don't work like they used to, and they're not able to care for themselves anymore because of that, even after they've stopped drinking, in fact.
Wow.
Yeah.
Okay, well, we have to take a break. That's a good question, Sharyl. And when we return, we'll be talking more about incapacity and guardianship, including Sharyl's top 10 tips on how to be a good steward of financial resources and how to account for it when you have to provide an accounting to a judge or to the beneficiaries. Stay tuned.
This has been Talk Law Radio with attorney Todd Marquardt, brought to you by the Marquardt Law Firm. You can learn more at marquardtlawfirm.com. And be sure to listen to the full Talk Law Radio show Saturday mornings at 11 on 9:30 a.m. The Answer.
Each week, attorney Todd Marquardt talks about the law. His mission with the Talk Law radio show and podcast is to help you discover your legal issue blind spots. In the beginning, God had one law. Don't eat from the fruit of that tree. Then came the 10 Commandments. Now we have federal, state, and municipal lawmakers that won't stop creating new laws. Laws that might impact you without you knowing it. Listen to the show and drop a line on Facebook or email host@talklawradio.com and let the host know what you think of the show, the topics you want to hear, and whether you want to be a guest.